Obamacare Affordable Care Act, ACA, healthcare.gov. Hey everybody, jmillen with Benefit Hackers. I want to talk for just a second about some recent changes that have hit effective January 1 of 2020. And because we service the employer marketplace where some employees have group coverage from their employer, some have coverage through some other avenue, and some employees waive coverage. I think this is important. So effective January 1 of this year, 2020, there were some mandates that went into effect. So first off, full disclaimer, everything you're about to hear from me said from this point forward needs to be vetted because things change all the time. I'm giving you a very preliminary understanding and overview of what's happening, but things are changing. So today is February the 27th. I'm looking online at the data that was posted effective October the 11th of 2019. Things change, okay? So I'm not trying to give legal advice. I'm not trying for you to make a decision based on this. I'm trying to open your eyes on what's going on so you can get the right decision, okay? So quick, when Obamacare came into place, there was what's called a mandate, individual mandate, that if you didn't have health insurance, when you could buy it, there was a penalty, right? There was a fee, there was a fine. Sometimes it was tied to a percentage of your household income. Over time, that has adjusted and changed. And as of today, effectively, there isn't really a federally mandated penalty from the federal government, okay? What has changed though in the past couple of years, or what's still in place, is what's called an individual mandate by the states. Again, I'm keeping this just very simple. So the federal government was fining and doing some things to people that didn't have health insurance, chose not to accept it. And that has kind of gone away now with the new administration, but there are some states that still require individuals under certain parameters to have individual coverage. It's minimum essential coverage, okay? And I'm reading online, effectively, January 1 of 2020, California is putting in their own mandate, meaning if you don't have insurance under their parameters, you could potentially be fined a certain amount of money for you and your family also, or a percentage of income. So it's a change in that the states are gonna now levy that fine for people. And so let's say you're working for an employer and you're 28 years old and you just say, I don't want insurance. That's your decision, but understand in California, there may be some things that you need to know about where you may get fined and penalized later. So just go into it open-minded and make a good decision. As of October 2019, District of Columbia, Massachusetts, New Jersey, Rhode Island, effective January 1 of 2020, has a mandate. Vermont, effective in 2020. So California was January 1 of this year, and then apparently DC, Massachusetts, New Jersey, Rhode Island is effective January 1, and then Vermont 2020 at some point. Then I have a list here of states that are actively considering this or pursuing an individual mandate. Connecticut, Hawaii, Maryland, Minnesota, Washington. What does this mean? This means if you essentially live in those states, definitely California, DC, Massachusetts, New Jersey, Rhode Island, and Vermont, there may be some penalties if you don't have health insurance under their laws. So check them out, go Google it. If you live in Connecticut, Maryland, Hawaii, Minnesota, and Washington, be aware. They're looking at that. So just be educated on what's required. Here's the reason I'm saying this. And again, full disclosure, I'm not an attorney. I don't work for the government, but here's why I'm telling you this. We meet with companies regularly, every week. And we inevitably have employees that say, when we meet with them, when we roll out a health insurance plan that's really good and that we have tried to optimize for that client, they say, I don't want insurance. And that's fine. It's their choice to take it or not. But if you're living in one of those states, you need to understand personally that if you don't get coverage when you're offered it, maybe let's say at work, you may be paying anyways through a penalty or a fine, and sometimes the penalties can be based on your total household income. I think it goes as much as 2.5% of your household income, which can be a lot of money, and it may be more than the cost of the insurance that you have at work. So just be aware. This whole video is just to raise awareness that Some of the states have already started to enact their own penalty. Some are looking at it, and this will probably evolve. I can't predict the future, neither can you. No one can. This may all go away. This may continue. The point is, be aware. I meet a lot of people that say, I don't want insurance. It's no good. It's too expensive. That's fine. That's your call. I'm not debating whether you should or shouldn't. I'm saying be educated that, for instance, if you're living in Rhode Island and you're making that call, you may be aware, maybe you want to look up what that penalty is, because anytime the IRS gets involved in penalties and fines and your paycheck, they seem to find the money. So, they seem to find a way to take it from you. So don't play games with that, is my suggestion, just my opinion. And if we can ever help you out, let me know. John Millen, Benefit Hackers. I hope this is helpful. Post comments below. Share this. Again, it's just awareness. This stuff changes. Tomorrow, it could all go away. As you know, that we live in a very fluctuating world, especially when it comes to healthcare. But I don't want you to be burned and get your tax bill and then find out you owe this money and you could have had insurance, in some cases, pretty decent coverage instead. Hope this is helpful. Thanks so much.